NCLEX, the National Council Licensure Examination for the Registered Nurses, now known as the NCLEX New Generation or the NCLEX-NGN. The NCLEX-RN exam is a standardized exam which is used for the registration of nurses for US, Australia or Canada. Now, NCLEX exam is a computer adaptive test, and this is done in order to evaluate a candidate's performance, so basic registration in any of these countries. Now, this will usually last for nearly 5 hours and it is a computer adaptive test. Now, what does a computer adaptive test means? The computer will be adapting according to the performance of the candidate. Now, normally a candidate might get around 85 to 150 questions. So, in an NCLEX exam, you get various types of questions like an MCQ, the multiple choice question. You might get a fill in the blanks. You might get a drag and drop. You might get select all that apply, where you get a MCQ with multiple options, or you can get even a hotspot question. You might get questions related to certain case studies. Okay, so that is the new method in which the NGN comes. So what are the general contents that is usually included in this NCLEX exam? So maintenance of safe and effective environment, the health promotion, psychosocial and physiological integrity. So these are the contents that is usually included in the NCLEX exam. So why should anybody go for an NCLEX-RN preparation? Now, in an NCLEX-RN preparation or the NCLEX-RN exam, you will be experiencing certain questions where you will have to apply the theory knowledge. So, in the training, you will be taught how to apply the theory knowledge in a practical situation. So, the second thing is that the NCLEX exam is not a knowledge test, but it is an application of the theory that you have learned. And you will have to assess the situation, prioritize certain things, or you will have to delegate, just like how you do in a practical situation. Now, the third thing is that in an NCLEX-RN preparation, you understand what is the pattern of the exam and what is the strategy to be applied to each of the type of questions, so which will be effective and help you to pass the exam in a faster manner. So the fourth thing is that this will boost your confidence. Now, the mock exams that you will be doing it along with your training sessions will help you to understand the actual NCLEX exam pattern of questions, understand the strategy and apply it, which will help you to answer the questions in a faster manner and understand the situations in a better way. The structured study platform will help you to gain the confidence in a better way, and you can avoid wasting your time. The next thing is that it increases the chance of your passing rate. As you would have studied, most of you would have studied outside US or Canada, you have learned the theory in a different way. But in NCLEX, particularly, they will be asking about the US patterns and methods. So you should be understanding that, and this can be gained through an NCLEX training or the mock exams that you will be getting as a part of the NCLEX-RN training. And this practicing of exams, so this will help you to familiarize with the US standards that is practiced in the hospital. And another problem that many of us face, since our first language is not English, is that the speed in which you can understand a question becomes difficult. So the next advantage that you get when you go for a training is you get an access to the updated study materials and practice questions, which will help you to make your training in a better way. So a most frequent question that a candidate asks is usually when to start the preparation for NCLEX. Now, NCLEX-RN preparation depends upon the person's capability. Now, depending upon your knowledge level, either you can start 8 to 9 months prior to your exam, or probably it can be included in your curriculum and you can learn it while you are doing your bachelor's or your diploma in nursing. Or even you could do at the last minute, that is, once you get the ATT, you have an ample time to prepare for the exam. So the ATT is nothing but the authorization to test, which you get towards the last step of the NCLEX-RN licensing process. So all these training sessions will be included in Medcity's NCLEX-RN training sessions. So ideally, it's better that you go for a training method, and this develops a skill, strategies, and confidence to write the exam.
Medcity International Academy. Trusted hands forever.